on technical guidance for supply chain health and also sharing from our research division as well. My name is Cameron Miles. I am a supply chain advisor in the Office of HIV/AIDS and the Supply Chain for Health division. I'm joined with Julia Bem, who is the Deputy Division Chief for Supply Chain as well. And we are here to talk about localization for supply chain. The local partner and global strategy meeting has shed light on a lot of diverse and many different ways of looking at localization. And for supply chain, this looks a little bit different, we would say, than some of the other areas where we've seen localization efforts for global health. We want to show you guys some considerations and some ways to look at localization for supply chain as you consider and plan for your activities in the future. And then I can just click. So some of the topics we're going to be talking about are defining localization in the context of supply chains, understanding the supply chain actors and how localization can impact those various segments of the supply chain. We're going to be talking about some examples of localization in countries that we currently work in as USAID. We are very proud to announce the supply chain division in OHA has put together a set of guiding principles for localization for people to consider and to think about as they move their localization efforts forward for supply chain. We'll go over those in a little bit more detail. And then we also will have just some suggestions and some mapping for localization in general and a strategy. So this is kind of an overview. I'm not sure if everyone here is supply chain oriented, but it's just nice to kind of see some of the areas where health supply chains work and what that looks like. So we have the kind of forecasting, pricing, negotiation, purchasing, ordering, storage and distribution, contract management, and all of these areas of supply chain can look very different from country to country. This is kind of just an iterative example of some of the intersections of those. Some countries, of course, have a more direct delivery system where you can deliver commodities directly to the last mile. Some countries, of course, have a central medical store system where things are delivered at the central medical store and then distributed to the last mile or to the final recipient. So this is in no way exhaustive of any examples. It's just kind of a grid to show you how many different areas of supply chain there are and how many different ways localization can occur within a supply chain. Moving forward with that example or that suggestion, there are two different kind of segments of supply chain. We can say there are things that happen upstream in the supply chain, which is this top row here, and then we also have things that happen downstream in the supply chain, which are happening more at the country level. At the upstream areas, we have things like manufacturing, quality assurance, transportation at a global international scale, stock centers, forecasting and supply planning. And then downstream, we have things like importing goods into the country, customs clearance, last mile delivery, service level delivery, and in-country transport. When we're looking at localization for supply chain, we've noticed that, and have lots of evidence and data that we have found more opportunities for localization downstream in the supply chain, so areas related to logistics, distribution, customs clearance. A lot of those are managed by local partners currently, and we'll get into details about how that is represented and seen in PEPFAR and how that's seen in reality and in a larger context as well. We have seen less opportunities for localization in manufacturing, global transport. Some things upstream are a little bit harder to localize. And to be honest, sometimes it doesn't necessarily make sense to localize those things. And we'll get more into detail about that later. So what does localization mean in supply chain terms? I think it's important to note how kind of USAID sees localization. And the way that localization has been defined at a USAID level and higher is that there are direct contracts, bilateral awards, government-to-government agreements, parastatal organizations, and these can kind of be measured by funding amounts. But there are a few factors where localization is happening, but it's not necessarily measured at a programmatic level. This includes things like contracting with local stakeholders, companies, technology firms, and to provide these goods and services at a lower level. So I've heard a lot during this conference about the localization efforts that happen with contracting. You'll notice that there's been a conversation where we have local partners under an international prime contract. And this is no different for supply chain. We hold one of the largest supply chain contracts in USAID history, which is the GHSC PSM project, an international company. But under this large contract, there are thousands of examples of local efforts that happen within each of these countries. We'll get more into that nuance later. However, that may not be captured at the larger PEPFAR level just due to the way that the funding is allocated. So we're going to go into some localization examples now. And how they differ. So using that example of our large supply chain mechanism, GHSC PSM, we have a few different ways in which localization is happening through these. You can see here we have about 56 local subcontractors through GHSC PSM. And with parastatal awards, we have about 5 countries that have parastatal agreements or G2Gs in some capacity. And then we also had 5 countries with direct bilateral activities that are taking place. This is based off of our previous COP, so COP 21. These numbers are subject to change each year, but it's kind of just important to see that map and the sub-layer under our large mechanism where localization is taking place. And quite frankly, has been taking place for several years, many years, actually. Here we can see some of the hybridization of some of those areas as well. Not one country does just one thing. There are examples where there might be a bilateral, there might be a local subcontractor, there might be a G2G or a mission award bilateral. All of these things can occur depending on the country context. And I think that that's going to be one of the key messages that we try to bring to you guys today about localization, is that localization for supply chain is country by country context. It will vary depending on how, where your supply chain is for your country at this time, and where you want to be in the next few years, and whether or not it makes sense to localize all aspects of the supply chain. We have some examples for Mozambique here, just that it's important to know that there are a lot of different funding areas where localization is taking place actively. And so these are some examples of local activities that are taking place in Mozambique. We don't need to go into detail, but just wanted to show you some areas where that happens. Outsourcing management, commodity distribution and transportation, and sample transportation as well. And how does localization fit into the larger supply chain context and strategy for Mozambique? You can see here, and these colors we're still working out how to clearly explain this to a larger audience, but there are different areas where localization is happening and areas where it is mostly controlled still by USAID in some degree or a donor in some aspect. So there are, in this green, you can kind of see there are areas where our international mechanism is more heavily involved in the supply chain. And there are certain areas in the purple here where there's kind of a hybrid cooperation and collaboration where there are local partners interacting with with the international mechanism, PSM in this case. And then we also have some examples where you'll see in gray later on where there is no presence or no local activity currently. This is another example we have from Uganda. They have several local contracts, large local contracts that are taking place. And you can see here for Uganda, we actually have a local partner here, JSM, and they pretty much provide all in-country transport and delivery for Uganda. So this is an example where they have a larger presence of local activity downstream in the supply chain, but you'll see up here, there are still areas where this upstream in the supply chain and at customs clearance as well, where there still is donor involvement with the activities related to supply chain. Moving forward, we're going to go over some of our guiding principles that I mentioned in more detail. So these are some principles that we think can be applied to countries considering localization in the context of supply chain. We have OHA views localization as a component of supply chain diversification and a pathway to resilient and self-reliant supply chains. Localization should be designed in a way that bolsters country ownership and governance of the supply chain. Localization should be considered within the broader context of regional opportunities for supply chain coordination. Country context and supply chain maturity determine readiness for localizing each supply chain function. Supply chain localization requires long-term strategy and multi-year investments. Localization of supply chain functions require risk planning and mitigation investments. Donors must consider and internalize cost and performance trade-offs. Functional areas for localization have unique limitations and considerations. Subnational partners should be engaged in localization efforts. And finally, localization efforts must be coordinated across health areas. So all of these points can almost take an entire other presentation, but we wanted to just introduce these concepts to you now initially, and of course we're happy to answer more questions about these principles as well. If anything, we are more than happy to start having these discussions in more detail as we consider localization efforts in your respective countries and activities that you work in. So how would you develop a localization strategy for supply chain? One of the ways to do that is to assess the readiness. Before even looking at how localization happens, some of the things that can happen at a higher level are looking at the resources, staffing, management capacity. These are some of the more important aspects, and to be quite honestly, this is a pain point in some areas where there may not be enough of a supply chain presence, or it's a shared responsibility or role, and less attention is paid to the supply chain in general. So this is an area where you can look, evaluate, and consider where missions and other partners as well can create more of a supply chain presence in their respective countries. Performance and risk management is self-explanatory. Understanding the risks of localizing, understanding partners and relationships and the trade-offs from donor-related activities and local activities are something that are being considered constantly. But it is important to bring that to the forefront when you're considering localization efforts. Local partner capacity, what are the financial systems, policies and procedures? How is that working with the larger goals of the country, as well as how the donor relates to the country? We also have just the entire impact of the supply chain. If you localize one segment of the supply chain, will this impact the larger processes for the entire supply chain? That's another area where we can consider that. So what are some of the takeaways when you're planning and building a customized plan customized to your country? Highlighting the most realistic options for optimal supply chain access, appreciating country context, as we mentioned a few times, and also, this can be interpreted as a blend of local and international service providers along both ends of the spectrum. I think it's important to realize that with supply chain, there will be global partners that you will be working with. It doesn't always look like a manufacturer will exist in each country to do the same functions. That might not make the most sense. However, there are different areas where localization happens. Regionalized manufacturing is a really strong point that I think supply chain focuses on. Doesn't make sense to just have a manufacturing or medicine facility in a certain region that can access and support various countries in that area. We have a pragmatic approach of supporting impact in supply chain systems because we understand that each country is different in this regard. And of course, localized customizations per country are based on competitive options, governance capacity, and optimized supply chain efficiencies. All right. So that concludes the presentation part of my speech. Thank you for your time, and I will now open it up for any questions that you guys may have, or any comments, or just any opinions about this in general. I'll also invite Julia Bem, if she feels so inclined, to also assist with any questions if she decides as well. But thank you. Also, if there's anything you want to add.
So I was reading on the bulletin for USAID in terms of the focus for which we are looking at in terms of localization. And in supply chain specifically, there's a mention on support for local manufacturing issues. I didn't hear much about it here. Are there any more details on how we are approaching it and which examples exist which have been supported so far? Thank you.
Sure. So do we want to, let's just answer the questions as they come, if that's all right. So for local manufacturing, we do have teams working on it. There's a lot of countries being engaged. In fact, we have the ARV meeting happening right now in Cape Town as we speak, where they're essentially meeting with the top ARV manufacturers who, some of them do have local manufacturing plants, especially here in South Africa. But I think the question is, how do we expand that and basically have capacity for manufacturing in more countries in Africa? I think, as Cameron touched on it, just like in a lot of supply chain, the likelihood that there will be an ARV manufacturer that can manufacture every country's needs in each country might not happen, right? Especially not in the short term. So I think when we really talk about local, especially in supply chain, we really do prefer the word regional. So, I think approaching these, especially the supply chain, from a regional perspective, right? So are there manufacturers that can produce for a group of countries? Are there supply chain actors? And again, this is very much typical in the supply chain, but there are a lot of logistics companies, right, all throughout Africa. Tons and tons of companies. But usually what they do is, if they're individual operators, they work for a larger company. And those larger companies are frequently regionally based too. And they partner with local trucking companies, local warehouse operators, to be able to build a network that can cross the continent. Because of course, people are typically moving things not just within, but across too. So a lot of the, especially private sector companies that are really well suited to jump into this work for us, aren't necessarily local from that perspective. So, it's same with manufacturing, same with the real logistics work that's going on the ground. It's, we don't want to lose economies of scale. We don't want to lose, expertise that may not necessarily be based in each country, but is certainly currently here within Africa and the continent. So, I think from a supply chain perspective, when we look at local, I think we're really positioning a little bit more towards regional and figuring out how we can ensure that the market is there for not just commodities, but also the services to ensure that, our programs are executed well, especially within our HIV world. Sorry, did that answer your question?
Thank you. I think I would beg to stand here.
Great.
Thank you very much for the presentation. I'm Moses from Uganda. I'm the chief of party for
Hey, Moses.
USAID Local Partner Health Service in the East Central region,
Okay.
implemented by Makerere University Joint AIDS Program. We are a comprehensive care and treatment project, TB, HIV, and a little bit of health system strengthening. And that's where I want to start from, because I'm very passionate about health system strengthening. Thank you for highlighting the different warehouses in Uganda. And I must say we are very happy with what those warehouses are doing. Thanks to USAID for the support. But as we discuss supply chain, I realized we've mainly focused on the hardware bit. And yet supply chain, we who are into service delivery, technical support for service delivery, there's a lot of software support that we're expected to do. And actually that constitutes, I could say, about 70% of the supply chain, the real supply chain. Because quantification and the procurement at central level relies on consumption data. And we are striving to support health facilities to avail the consumption data. So my first ask, I would like USAID, I request USAID to coordinate at central level, the different funding streams. You have Global Fund, you have national governments, you have USAID and other partners bringing in resources, but differently, I don't know whether in a coordinated or uncoordinated manner, but we get frustrated as partners who are supporting service delivery, under supplies, frequent stockouts. So we really get frustrated, and yet we are striving to provide accurate consumption data. So I would like you to take note, and that's why I chose to come and stand in front here. I would like you to take note of that and escalate it to whatever level. So coordination at central level. Two, as local partners, we were carved out of the regional mechanisms which were being spearheaded by international NGOs. My region was under University Research Company, and now we are local partners. And USAID says the guidance we received is that supply chain and other components of health system strengthening will remain under the international IP. Now, we kind of get lost because whereas we are supporting service delivery, you can't support service delivery unless you're addressing leadership and governance issues, you're addressing supply chain issues, you're addressing HRH issues, moving as one package, cascading one package of technical assistance. So we'd really need clarification to what extent local partners will be supporting supply chain interventions. So I would like also that question to be escalated to whatever levels, because a decision needs to be taken, and maybe some level of funding needs to be extended to us, because we have the capacity, but we don't want to cascade piecemeal technical assistance. And yet the districts and health facilities are looking at us. So they are asking for us for what we don't have. So supply chain. And I don't know whether this happens in other countries, but in Uganda we have supply chain structures at district level, whom we call district medicines management supervisors. We as IPs are expected to facilitate their work. They support the health facilities in dispensing quality or doing what you've heard about SPAS, supervision, performance assessment, and reward strategy. So dispensing quality, ordering quality, prescription quality, stock management, and others. There are 5 constructs, quality constructs. So indeed, that's what we should be doing. So we would like USAID to pronounce itself on whether the local partners will be funded to continue supporting supply chain as part of the comprehensive package towards the epidemic control. Thank you.
Thank you. Well, those are great points. I think they're points that a lot of countries struggle with, regardless of whether the partners who are at the health facilities are local or not local. Supply chain is really a function that flows throughout the entire program, and we definitely have been working with care and treatment partners to be able to provide technical assistance, since they are really the ones in the facilities, right? I mean, the supply chain is a big operation, but we don't necessarily have people at every single facility, but the supply chain functions are occurring in all the facilities. So it is definitely something, even outside the localization kind of theme, that we have been, tackling and working with, but I think all your points are very valid. And it's definitely something for us to bring back and think about. Thank you. We do have some questions from Peter. Actually, he has 3 questions online here. So Peter, I'm going to address your questions. His first question: how are the local partners able to learn from the COVID-19 experiences that caused delays in shipments, thus causing intermittent stockouts? So this is an interesting question. For most of our countries, procurement is being handled at a global level, but regardless of how procurement is being executed, obviously we live in a global world, right? COVID impacted supply chains throughout the world and impacted everybody, regardless of health or not. It was, a major blow to all industries. I think one of the things that was really clarified with COVID is in the supply chain world is countries that had strong supply chains, had supply chains that were able to respond quickly, did better than countries that, internally had supply chains that were struggling before COVID. Again, for us who work in the supply chain field, COVID, the kind of silver lining in COVID was that I think everybody in the world realized how important supply chains are to our everyday lives. People who are receiving medicines at facilities obviously feel it, but it's just something that's been elevated into kind of like more of the common talk, I think, because COVID really made it clear. So I think, I'm hoping, the COVID experience has really elevated the importance of strong supply chains within all of our countries and elevated kind of the knowledge about what supply chains really mean and do. And hopefully that translates down to local partners as well. Does anybody, sorry, Cameron.
Well, no, I just wanted to add on to that and also answer the question that was shared just now, and also in relation to one of Peter's questions related to HR and human resources. I think that that's one of the key areas where localization can be easily looked at and assessed for supply chain. And I can just share from my most recent experience visiting DRC, visiting various health facilities at all levels, including community centers, hospital health zones. One thing that we found that was very interesting was just the amount of training on supply chain and educating healthcare workers on what supply chain management looks like, how that data is reported, and how that's shared at various aspects. And I think that we agree it's one of the areas where the government can kind of look at ways to train and promote supply chain education for its respective country, but it's also just an area where we see a lot of area for growth and education on the supply chain. You have healthcare workers that are doing multiple functions, and often supply chain becomes kind of, unfortunately, maybe a back burner issue as they're trying to deal with patients in real time. But I think one of the ways to do that localization can happen at the supply chain level and build capacity is to look at ways where we can educate everyone at all levels of the supply chain, and also develop enough opportunities and resources for people to understand those positions and how it fits into their respective health chains. So that was just an answer to, or not an answer, but just maybe a comment to Peter's question about HR, and also touching on the HR issue. And the other part I was going to bring up was the technology. I think, of course, that is one of the biggest areas where supply chain is is so technically based, is in software and in data transferring, data management. Understanding the same information at all levels, of course, is an extreme challenge. But I think that that's definitely an area where cohesiveness needs to happen, and it sometimes may not make sense to localize data sources or technologies. It may make more sense to globalize something like that. That's one of those areas where it's a little contentious. Does it make sense to localize technology and software, or is it something that needs to be kind of looked at a larger global scale for the betterment of a larger area? But those are my 2 points.
Thanks, Aaron. Sim, please.
Thank you very much for the very insightful presentations, and I really appreciate, I think there's one slide where you clearly showed throughout the continuum of supply chain the different functions and the possible options and opportunity for localization. It's very helpful. Now, I think personally that localization, it's much more complex when it comes to supply chain because of its nature and the complexities and the fact that in many parts of the continent, I think, let's say West Africa, for example, it's at a disadvantage when it comes to industrialization of, let's say, the supply chain with limited infrastructure for manufacturing at the regional level. So there's a high reliance on import from very far. Now, when countries are considering localization, what type of support, beside the guidance, is available at USAID Washington to help those countries develop their localization, supply chain localization plan, and also the support to implement those planning? Because what will work in one country may not work in another country because it depends on so many external factors, including the political environment and the socio-cultural environment. Are you planning, for example, to have like support to help countries assess the maturity of their supply chain system and also suggest options to consider for localization? Thank you very much.
Thanks, Sim, please. Yeah, great question. So in terms of our support, I think we've been, again, the localization efforts have been very country-based, right? So there's been very different types of localization work and efforts. Some countries, we saw Mozambique, they have 3 kind of local awards to supply chain companies working on not just distribution and warehousing, but also on helping the government learn how to outsource and manage outsourcing, right? So that is key, and I think we've worked with a lot of countries in getting to that. We've developed tools, and we've definitely led lots of TDYs and kind of, but essentially, you know, when it comes to localization and supply chain, as you said, it's very complex. What a lot of the focus that we've had on is essentially helping governments become stewards of the supply chain rather than necessarily operators. So helping governments understand how to connect with the private sector and those companies that are operating in their countries and how to manage those activities. That's just one way that we've supported. We've also supported, you know, in Rwanda. Tomorrow afternoon, we have a presentation on it. Rwanda will be given, but essentially there, we've helped them establish, it's called RMS, Rwanda Medical Store, but they are shifting a model to become more of a private sector entity and learning how to do the procurements, management, basically, you know, as a private sector entity. So that is something that USAID did support. Again, I mean, we definitely are there to support. We've developed lots of tools. If, you know, your country is interested in figuring out more ways that you can, you know, start to localize, absolutely reach out to us at the SCH division in Washington, D.C. But I think one of the best examples is just looking at your fellow countries, too, and seeing what they've done and how they've done it and figuring out if that applies to your context and if it makes the most sense to your context. Because a lot of times what works in one country isn't necessarily going to work or isn't the right path, right? And I say this because I think a lot of countries are not just in different places from a maturity aspect, but also different places from a market aspect, right? Just like manufacturing, we have a lot of countries that have a strong private sector market, and then we have countries that don't have a strong private sector market. And when I say private sector, I mean not just manufacturing, but warehouses, infrastructure, distribution companies, et cetera. So it just depends where you are and what the right steps are. But we are definitely willing and there to help. Are there any more questions? Oh, sorry.
All right, thank you very much. I wanted just to understand OHA's position on infrastructure. I'm asking this from a place where sometimes you hear stories about commodities getting damaged because maybe they were not stored in a safe place, or else commodities being damaged because of struggles of road passages to get to hard-to-reach places. From an integration perspective, what is PEPFAR's position in allocating resources towards infrastructure development? Thank you.
And what country are you from? Sorry.
Malawi.
Malawi, okay, hi. From a supply chain perspective, we have definitely moved away from paying for large infrastructure investments and upgrades. You know, as a whole, I think you know, again, resources are not never ending. And, you know, I think it's come to a point where we are figuring out how we can utilize what's available and move from there rather than putting in large-scale funding efforts to build new warehouses or to fund, you know, better trucks for countries. I think what we found is, on a whole, for most of our countries, those infrastructures are available in country through the private sector. Not all countries, for sure, but the private sector is definitely something that we need to tap into a little bit more if infrastructure is something that's really a problem. Because they have an incentive to ensure that that infrastructure actually is maintained, right? A lot of times when we've built, you know, government-run warehouses, there isn't necessarily that incentive to maintain those structures, and if there isn't funding behind it, then they also don't get maintained. So, you know, I think we've done a lot of work over the last 20 years in terms of, you know, building infrastructure in countries that just had none. But at this point, I don't think PEPFAR, well, for our position, PEPFAR is not necessarily going to be continuing building warehouses and donating lots of trucks. But it is, again, a very country-by-country discussion because, of course, the context matters. Peter has another question on the screen here. So I'm going to take Peter's question, and then I'm going to wrap up because we got to move on. So Peter actually has 3 questions. Peter, you have a lot of questions, which is great. So maybe I'm going to ask you to contact us, but I am going to answer. I'm looking through your questions right now and make sure. At the storage. He does ask an interesting question about supply chain costs per patient. Is it possible for USAID to disaggregate the supply chain cost per patient, and what is the average supply chain cost per patient? This is a really interesting question, only because I feel like we get asked this question all the time. And Peter, I really would love it if you emailed us so we could have a further conversation about this, especially country-based. As you can see from those bubbles that were somewhere earlier on in this chart, and Simplice brought it up, there are a lot of activities that happen in the supply chain. And very rarely does USAID or any one donor really fully fund the entire chain, right? And it has a lot of different components to it and LOE. We have absolutely tried to, country by country, come up with a cost per patient. And, you know, again, I'm going to say I don't have an answer for you, Peter, but I would definitely love to explore figuring out an answer for your particular country if you are interested in it. All right. Well, thank you, Peter. Thank you, everybody. Thank you, Cameron, for presenting. Hand it over to the
Thank you for your
research.
time.
Thanks so much. Good afternoon, everyone. My name is Alexa, and I'm the Portfolio Coordinator for OHA's Research Division. I'm joined by my colleague, Ashley, who will be presenting later, and she is a health science specialist in our vaccine branch. So today we're going to be providing you with an overview of research activities and different opportunities for engagement. So as outlined here, we will begin by introducing you to OHA's Research Division, highlight local partner activities, resources, and opportunities across OHA's Research Division projects, and then provide you with a brief overview of policy and guidance updates for biomedical prevention tools and products, and then open it up for Q&A. So I know this is a busy slide, but bear with me, we'll kind of walk through it together. So despite global progress getting people on HIV treatment, 1.5 million people became newly infected with HIV in 2020, with women and girls accounting for 63% of all new HIV infections in sub-Saharan Africa. So we know that oral PrEP works if you take it. So you can see that on the graph on the left-hand side, the trial graph with all the little dots. But a recent global systematic review and meta-analysis in Lancet HIV showed that approximately 41% of people who start taking oral PrEP discontinue it within 6 months. So discontinuation and poor adherence to oral PrEP diminishes its public health benefits. So despite it being a quote-unquote successful product, we all know it's very highly effective. Scaling up oral PrEP on its own doesn't necessarily translate into a highly successful prevention program that can achieve and sustain epidemic control. So there's an urgent need to develop and introduce additional high-impact biomedical prevention products to expand our prevention options and then provide end users with a choice of products that fit into their lifestyles and help us ultimately end the pandemic. So here's a simplified version of our end-to-end model for research and development to access and program impact. This model highlights how our work dynamically advances research and development for program impact while leveraging partnerships. And moving from left to right, as you can see, we focus on research and development of HIV vaccines and microbicides, optimal biomedical products for end users in low and middle income countries, new product introduction and broad access, and then global partnerships and local research expertise for impact. And then importantly, by that big yellow bar on the bottom, we engage in capacity strengthening and advocacy throughout each stage of this model. Okay, another busy slide. But as you can see, the HIV prevention product ecosystem is complex and robust, and this has really resulted in engagement and coordination at multiple different levels. Of note, many of these engagements and relationships enable our division to be flexible and dynamic and support expansion opportunities for more sustainable impact. So I'm not going to go through every bubble, but I'll do a few quick highlights. So for example, with NIH, we work closely with them on broadly neutralizing antibodies, or BNAPs, particularly for prevention of mother-to-child transmission. CDC, we work closely with on product resistance monitoring and then exploring different integrated resistance monitoring systems for more cohesion. And then with SCAC, we're working currently on reinvigoration of implementation science and more surveys and research. Oh, Sorry, I'll slow down. Okay. So the research division also has intensive external advocacy, where we engage at multiple levels with diverse stakeholders. This slide includes some of those key relationships critical to advancing products through the pipeline. So another few examples. So with pharmaceutical companies and product developers, we work closely to utilize existing active pharmaceutical ingredients, or APIs, for new products and to explore opportunities for additional therapeutics. And we also leverage private sector partnerships to explore innovative financing and local manufacturing approaches for sustainable impact. Okay, so elements of our research approach are included in all 5 pillars. And if you don't know, this is Ambassador Nkengasan's 5x3. And this session will focus primarily on pillars 2 and 5. So localization is included as focus area 2 under pillar 2, sustaining the response, which is appropriate given that strengthening local institutions is an essential step towards sustainability. The research division's vision for localization is very closely aligned with PEPFAR's, as you'll see. And research is also included under pillar 5, follow the science. So the research division supports 4 major projects that prioritize north to south collaboration and are centered on local partner leadership and visibility. So ADVANCE aims to develop a safe and globally effective HIV vaccine. Matrix focuses on developing new value-add HIV prevention products. Mosaic aims to develop simplified service delivery of a multi-product platform to promote people-centered supply chain solutions for an increased product uptake and continuation. And finally, CASPER focuses on creating a locally led and managed advocacy, policy, and communications network focused on the biomedical HIV prevention research pipeline from research to rollout. And we're going to be going through each of these projects more in depth, so don't panic. Okay. So first we have ADVANCE, and the goal of ADVANCE is that a safe and globally effective HIV vaccine and biomedical prevention products are developed with leadership by African and Indian stakeholders, and that they are available and accessible to populations at risk of HIV acquisition. This 10-year program funded by PEPFAR is part of IAVI's ongoing 22-year collaboration with USAID that has significantly advanced HIV vaccine research and development while accelerating the search for innovative biomedical prevention tools, including a safe and globally effective HIV vaccine. Okay. ADVANCE is dedicated to the development of this safe and globally effective HIV vaccine and other biomedical prevention products that are available and accessible for populations at risk of infection. And this is really centered by leadership with African and Indian stakeholders. So through the 4 strategic areas outlined on the right-hand side, ADVANCE aims to establish a sustainable and self-reliant clinical research center network, CRCs, to inform sustainable HIV vaccine research and development through strengthening African clinical research capacity. They also aim to strengthen their African Translational Research Consortium, which informs the prioritization and testing of vaccine candidates and supports research to advance understanding of distinct features of African host immunity and viral variants. And then finally, the primary goal, as I have said several times, is to develop a safe and a globally effective HIV vaccine. So this slide illustrates ADVANCE's robust CRC network. So again, these are the clinical research centers. And as outlined on the box on the right-hand side, they really focus on building scientific capacity and promoting different trials and really focusing on TA and capacity building. So the clinical trials are conducted at highest international standards with state-of-the-art clinics, pharmacies, and labs to establish different technical platforms. Included in this work are things such as antibody cloning, neutralization assays, sequencing capacities, genomics, single cell sorting, and a lot of other highly technical terms that I will not bore you with. But the CRC network provides a foundation for research preparedness and community engagement. And application of epidemiology and engagement ensures that the most at-risk populations will be included in clinical trials so that products really are informed by everyone in all different sorts of groups. And of note, Advance focuses on these diverse populations, including men who have sex with men and transgender women, sex workers, fishing communities, adolescent girls and young women, among many others. Okay. So as far as local partner engagement, there's no direct opportunity with Advance at this current moment, but the CRCs encourage local engagement with different local entities to promote research capacity building and trial alignment, data alignment, things like that. So everyone is encouraged to coordinate and collaborate with those CRCs. And Advance is also building a trusted research environment, which they call the TRE, and that may be open to data from new partners as early as mid-2023. And this platform is really designed to promote more data and information sharing so that we can apply lessons learned more broadly and learn from each other. Okay. So now we're going to move on to Matrix, and the Matrix Award aims to advance innovative products for women through a collaboration of partners with diverse, complementary, and relevant capacities that, when combined, accelerate the research and development of HIV prevention products that women can choose to protect themselves and address the continuing and disproportionately high rates of HIV incidence in women, especially adolescent girls and young women in sub-Saharan Africa. So this award is a $125 million 5-year program funded by PEPFAR and is led by MWRI and currently has 19 partners and focuses on 6 different technical areas. And through this program, US and African scientists are co-leading and working to advance the research and development of these various new products. Again, this is another busy slide, so I'm not going to go through every detail, but it outlines some of the major technical areas. So for example, the early stage product research and development technical area is focused on this very early stage development. And then, for example, technical area 4 is focused more on participatory research and engages early in product design with stakeholders to make sure that the products that we are researching and investing in really do meet the needs of different end users. And that one is also referred to as D2D. We love our acronyms in research, so if I forget to define it, please just let me know. But yeah, and then another one, technical area 6, focuses on the business plan for development and different market assessments, and that one's called BAC. So that really focuses on making sure that we're investing in products that are usable and will ultimately be affordable for programming. Okay. Sorry. Sorry, my notes are not advancing here. Okay. So traditionally, research is kind of defined and prioritized by what's called like the global north, but the goal of Matrix is to really change that dynamic and make sure that research priorities and focus areas are defined by people in country, for countries, so that products are more optimal for end users. So that's kind of where Matrix model of co-leadership comes in. It's really designed to help capacitate leaders in the Global South and make sure that they are prepared to and capable of leading and being the prime awardees on future awards so that we're really transitioning the award management and research leadership to local scientists. Okay. And then I'm going to, one more, sorry. And so then as far as opportunities, Matrix actually has quite a few for different local partners. So I encourage you to take a picture or write down the email if you have interest. They definitely would love to hear from you. So the first one is called our Technology Accelerator, and the goal is to support innovative, potential new technologies for HIV prevention and multi-prevention technologies. And they really provide kind of seed funding to do that initial research for those products. And then for the Integrated Special Projects RFA, the goal is to support focused projects that add value or enhance existing research infrastructure. So that one's very based on infrastructure, capacity building, things like that. And then the Case Hub Fellowship Program, unfortunately, is currently only open to organizations in South Africa, Kenya, Zimbabwe. And then the aim is to cultivate a self-sustaining network of African research leaders in prevention research. So it's both for knowledge sharing and management, and then again, this capacity building of our local researchers. Okay. Then I will now hand it over to Ashley to continue on.
Okay. Good afternoon, everyone. Good afternoon, everyone. Thank you. Okay, so I'll be talking about our third agreement that we have in the research division. I did just want to point out one thing that supply chain said earlier that I wanted to kind of piggyback on. And we were wondering why we were grouped with supply chain at first, and I think that we realize now that's because a lot of our localization efforts do involve a major international prime and then working with sub-partners that are local partners. And we've really try to change the way that our agreements are structured so that even though they are subs, they take a lot of leadership and have a lot of visibility within our programs or within our projects. And I'll try to slow down also because I'm sure that's coming. Okay, so again, I'm Ashley Lima. I'm a health science specialist in the research division. I specifically sit on the HIV vaccine branch. And today I'm going to start with Mosaic. So I'll be moving us along from research and development, which Alexa talked about with Advance and with Matrix, right? On to introduction and access with what we call the Maximizing Options to Advance Informed Choice for HIV Prevention Agreement, or also called Mosaic. So Mosaic is a 5-year agreement funded by PEPFAR through USAID, and it's funded to help AGYW and other women prevent HIV by accelerating introduction and scale-up of new and emerging biomedical prevention products. So the project works across multiple countries, and the goal is to implement user-centered research and research translation efforts to identify, understand, remove barriers to, and also advance new product introduction and access and use, and within doing all of that within a multi-product market. So that's kind of shown here with these different puzzle pieces. And as of March 2022, Mosaic had USAID mission concurrence to work in several countries, including Eswatini, Kenya, Lesotho, Namibia, Nigeria, South Africa, Uganda, Zambia, Zimbabwe. And discussions are also underway with the mission in Botswana, and then other countries may also be engaged in Mosaic as interest and need arise. Matrix is a consortium at the end of the day, and it's led by FHI 360, along with core partners VITS RHI, Pangea Zimbabwe AIDS Trust, or also called PZAT, LVCT Health, JPIGO, and AVAC. Local partner leadership and engagement, particularly in sub-Saharan Africa, is really intrinsic to this project, and its approach to expediting women's access to new HIV prevention products and choice. And in fact, one of Mosaic's five strategic pillars is to strengthen and sustain local partner capacity to advocate for, design, and implement high-quality product introduction activities and research. Local partners working with Mosaic include youth-led and women-led organizations, organizations involved in DREAMS, and organizations that are particularly focused on AGYW and female sex workers, even if they're not youth and women-led. And Mosaic works with these partners by providing subawards and small grants. They conduct participatory capacity assessments and work with local partners jointly to develop capacity kind of improvement plans tailored to each of the partners' needs. Other capacity strengthening activities planned under Mosaic include formal training, self-directed e-learning, virtual technical assistance, on-the-job mentoring, and provision of tools and job aids. Okay, so if you're familiar with Mosaic, which some of you may be, you may have also heard the project's name kind of mistakenly interchanged with Catalyst. And CATALYST is an acronym for Catalyzing Access to New Prevention Products to Stop HIV. Again, we love our acronyms. So CATALYST is Mosaic's main product introduction study, and it assesses implementation and enhanced service delivery package providing choice of PrEP, ring, and injectable PrEP among women. These implementation studies are delivered at public sector sites in Kenya, Lesotho, South Africa, Uganda, and Zimbabwe, as shown on this slide. And CATALYST has three main objectives, also shown on this slide. They boil down to assessing the facilitators and barriers of the implementation process, patterns of use and effectiveness, so acceptability and adherence, continuation, switching, discontinuation, and also prevention effective use, so like using tools so that they're actually preventative in nature. And then the last kind of objective is clinically relevant indicators, so rates of infection and drug resistance. So we see the CATALYST study as really being our first step for introduction of new products into health systems and programs, and the study is really designed to provide evidence that will be useful for governments, implementers, and funders in designing national plans and national programs to provide women with choice of HIV prevention products and options. Next slide. So you all definitely cannot read that, so sorry about that. But outside of CATALYST, Mosaic also supports a myriad of activities for CAB along the introduction pathway from development of policy, strategy and costing models to supply chain and market development, and through service delivery uptake and monitoring and evaluation. So basically this table is just showing the different kind of sub-activities that fall under each step along the product introduction pathway. So how can local partners leverage Mosaic to inform PEPFAR program planning? So first, you can leverage learnings from CATALYST, and these learnings typically address research gaps prioritized by the WHO related to CAB and the ring, including those listed on this slide that I won't read through. And then Mosaic will also inform country operational planning. So Mosaic HQ at USAID Washington has dedicated LOE to provide light technical assistance to non-Mosaic countries, so countries that were not listed and shown on the map that I had up earlier, regarding new product introduction. So for example, they might provide TA on how to conduct a value chain situational analysis. And then finally, Mosaic is really well aligned with PEPFAR's reimagined strategic direction. So for example, CATALYST will be addressing key forward-looking questions and rapidly translating findings. Next slide. And then finally, efforts towards R&D and INA would really be futile without also supporting cross-cutting work that addresses the social, structural, and policy barriers to HIV prevention. So to this end, the research division supports the Coalition to Accelerate and Support Prevention Research, or also called CASPR. This is actually the agreement that I support in the division, so I have a little bit of extra love for this one. And so CASPR is an Africa-centered network dedicated to advancing advocacy policy, regulatory communications, and stakeholder engagement efforts that help accelerate biomedical HIV prevention research. And they do so through a network of strategic partnerships and activities. The coalition is made up of 14 partners, 9 of which are local organizations, which you can see some of their logos here, that are located in Kenya, Malawi, Nigeria, South Africa, Uganda, Zambia, and Zimbabwe. And CASPR works through 3 strategic pillars. Also shown on this slide, the first is advocacy network and policy engagement, and this involves strengthening and expanding the global advocacy network and advocating for an enabling policy so that those related to the inclusion, such as those related to the inclusion of pregnant and lactating people in HIV prevention research. So one thing we did recently was hold a large think tank, a high-level think tank with leadership from different organizations and agencies on how we can advance including women who are pregnant and breastfeeding in research. The second pillar is research translation, and this includes activities that move research into policy and practice. And an example of this would be media cafes that we hold in different countries that really bring together journalists and scientists to advance communication of the current science and make sure that the science that is current is understood by the masses. And then the final pillar is research preparedness, and this involves protecting and representing the rights and interests of community members and end users through the process from research to rollout, so across the pipeline. And to this end, AVAC has been really at the forefront of training and education and dissemination of guidelines related to good participatory practice. Next slide. All right, and then CASPR has a number of resources for local partners who are involved in biomedical prevention research. And the first would be the Engage platform. This is an online learning platform that allows peer-to-peer sharing of among HIV prevention research stakeholders. It has free courses, webinars, as well as spaces for users to network, collaborate, and develop joint strategy. The second is the Advocates Network, and that's an electronic network that allows stakeholders to receive timely updates about the field of HIV prevention research. And then the last is PX Pulse, and this is a monthly podcast on biomedical HIV prevention developments. And so the last two were focused on the science behind HIV vaccine and then related challenges, and the one before that was focused on getting the ring rollout right. And currently, CASPR as a coalition, so this is kind of the same thing we were saying about Advance, where you can actually engage with the CRC network that is within Advance as individual CRCs, and it's kind of the same for CASPR, that currently CASPR doesn't provide routine TA to PEPFAR programs through USAID mechanisms, so you can't necessarily as local partners engage directly with CASPR as like an agreement. But within CASPR, we do have like the individual agencies that really drive home the goal of CASPR. They are CASPR, if that makes sense. But if you have one of those organizations in your country, we encourage you to reach out to collaborate on advocacy, policy, or communications. And then in some ways, CASPR as a whole does provide support to programs through USAID HQ. So for example, they did develop talking points on PrEP for AGYW. For programs to use with local government. And so I'm not sure if any of y'all were able to catch one of the satellite sessions earlier in the week where CASPR actually presented on advocacy with local governments. And again, that was a local partner that presented on that topic. Next slide. Thank you, Alexa. And so finally, understanding that RES opportunities and resources may not be as relevant for some local partners because we know that many local partners aren't actually conducting research, or that you may not find ways to engage with us or the projects that we support. We'd still want to leave you with key policy and guidance updates for biomedical prevention tools. So here we have a timeline of WHO recommended ARV-based prevention products. Their first recommendation for PrEP, as I'm sure we can all remember, was in 2016, and that was a strong recommendation with high certainty. They followed in 2021 and 2022 with subsequent recommendations for the ring and CAB-LA. We also know that notably SGAC released FAQs related to the ring in June 2022, stating essentially that PEPFAR funds would not be available for ring procurement, but would support program implementation when it's procured by other donors. So if other donors procure the ring, then PEPFAR would support implementation with the ring, and would also support procurement for the ring for PEPFAR-funded implementation studies. That's essentially where PEPFAR funding support for the ring ends. But just this week, the SAB, or the Scientific Advisory Board at PEPFAR, released additional and final guidance that not only suggested universal strong support for CAB-LA, but also recommended that PEPFAR explore opportunities to procure non-FDA approved products that WHO recommended. And so that's a really good sign for ring because really that came out of discussions about why PEPFAR could not support the ring. I'm not sure, well, I don't think I mentioned this earlier, but CASPR was played a huge role in providing recommendations and advocating for ring procurement during the last SAB meeting. So really this kind of idea of exploring opportunities to procure things that FDA doesn't necessarily support is a good sign for the ring overall. Next slide, okay. And then, which one is this? Yeah. So WHO implementation guidance for simplified and differentiated service delivery of PrEP, very long name, includes recommendations for PrEP options as part of combination prevention approaches towards the demedicalization, simplification, differentiation, digitalization, and integration of PrEP service to increase uptake and effective use of PrEP. So this is more WHO guidance that came out in 2022. It's been a busy year for PrEP guidance and WHO guidance. And the guidance also included updates to the oral PrEP dosing frequency. Next slide. And that guidance also included updates to PrEP testing requirements, which are shown here and which have been pretty heavily covered, I think, by PEPFAR and SGAC, but I do see some cameras going up, so I'll just go over them briefly. And that guidance included new guidance on HIV self-testing, so that HIV self-testing should be offered to increase the frequency of testing and reduce the need for more clinic visits, thereby making it easier for folks to actually receive testing. But positive HIV self-tests should be confirmed in person at the clinic. There are also changes to requirements around Hep B and C, so when possible, it's important to test for both within 1 to 3 months after oral PrEP initiation, and then also around kidney function. That routine testing for kidney function is no longer required for PrEP users who are 30 years and younger. And then finally, on July 25th, WHO, IAVI, USAID, and Wellcome Trust launched the guidance document for preferred product characteristics for MABs, or monoclonal antibodies, for HIV prevention. So just a little background on PPCs, or again, preferred product characteristics. These are technical documents that are developed when a product is kind of like just being developed, to articulate preferred attributes of that product for licensure, policy, and programmatic implementation. And highlights from that document are shown here. I won't review them, but we do want to also note that this kind of newish technology are also being looked at for viral load reduction in HIV individuals and are seeming to be proving effective. So that's also good news coming out of the research field. Okay, and so that brings us to the end of our presentation. I just wanted to stop and pause, and this is our team. On the left, we have the HIV vaccine branch. On the right, we have the microbicides branch, and then we have our front office where Alexa sits on the top. I just want to thank all our colleagues for their contributions, and note that we are covering for several teams and can bring back any questions that we don't have answers to our colleagues at HQ. Thank you. Oh, and then I'll invite you up, Alexa, for questions. Any questions on research? Should I? Let's see. That's here. I'll just.
Thank you. My question is on PrEP injectable. Is it now it has been approved by WHO? Is it funded by PEPFAR now? And when should we expect it to be part of the COP planning? Thank you.
So thanks so much for your question. I'm going to repeat it just to make sure I understand. You're asking whether it's funded now, and then if not, when should we expect funding, right? So no, it's not funded quite yet, and we can't really say when we can expect funding, but we did just hear on Tuesday during the plenary for HQ that there, and it was also released by the SGAC SAB, that there seems to be overwhelming support for Cabolet for injectable PrEP. So we're hoping to see more about that soon. Thanks. Other research questions? I think we have one up front.
Thank you. Very interesting research, especially on PrEP. But my comment also borders on specific research issues around supply chain. I expected to see that, so that I think as we talk localization, we should be able to see some research results on some of the implementation which is happening elsewhere, so that we can learn the best practices. But otherwise, I think it's a very good presentation on the PrEP, and we have a lot of challenges with retention around PrEP, so yeah. I also expected something around that, because I think most of the people from the data we see, they do drop off and come back, and we're having a lot of challenges in terms of keeping people on PrEP, despite them being still at risk, and I would love to see something around that as well. Thank you.
Yes, thank you so much. So you're exactly right. We do see a lot of issues around retention with PrEP, and that's kind of like one of the foundations of the work that we do in support in RES. Across our projects, one thing that we really concern ourselves with is product choice. And that's because, as Alexa mentioned at the top of the presentation, we know that as people, especially, I think we have more research for women, but have more choice, they're much more likely to adhere to PrEP. And so that's what, for example, the Matrix project is focusing on optimizing prevention options, if that makes sense. So not only are we supporting research and development, but we want to support a wide array of choices so that we can understand which one works best, which will be which will see the most uptake, which will see the most adherence, et cetera. And then kind of same for Mosaic. That's why we have those 3 major products within Mosaic of PrEP, PrEP Ring, and CAB-LA, and looking at implementation science studies to see, what are the issues around acceptability and adherence across those products, excuse me. And then for your second question on supply chain, not my realm at all, but I will say that under Matrix, that's something that I personally just got an email about since I've been here, that the Matrix team is looking to explore in-country manufacturing as like an option of things to support under their project. So I think those talks are pretty early. I know Casper also recently held an R&D week, an Africa R&D week, and I can't remember where that was based, where one of the key objectives was to explore in-country manufacturing of products, and that's why I got the email. So as we continue to hear more about that, we hope to hear from you and we can share news. And you should also join the Advocates Network because they'll be sharing out news also as it develops. So. Other questions on research? Okay. Well, thanks for joining us. And feel free to pull us aside if you see us throughout the day to ask any questions you didn't want to ask here. Thank you.
Thanks, everyone.